All right, hi everyone. My name is Caitlin Hooker, and I will be doing a Astrand cycloergometer submax test with my lovely patient Amber over here. She has been warming up for about 3 minutes at a wattage of 25 because that is the lowest that the bike will go. And for the duration of the test, we want her to keep her RPMs between 50 to 60. And so we're just going to go ahead and start the test. Based on the Astrand recommendation, because she's a conditioned woman, I'm going to start her at a workload of 600, which is equivalent to 100 watts on this bike. So I'm going to go ahead and bump you up there. All right. And I'm going to have her pedal at this workload for about 3 minutes, at which I'll take her heart rate and her blood pressure. So while we're waiting, or while she's pedaling, prior to the start of this test, I asked her a bunch of questions to assess her cardiovascular risk. And based on that, she has a low risk status, as well as a low to moderate level of exercise, depending on the week. And her resting vitals, her heart rate was at 52 beats per minute, and her blood pressure was 115 over 62 millimeters of mercury. Because of her low cardiovascular risk and her resting vitals within normal ranges, those were indications that it was safe to start the test and have her perform it. She also, prior to the start of this test, indicated an RPE, or a rate of perceived exertion, at 6. And we also adjusted the seat so that it fit her body structure. We wanted the seat to be at her hip height or at the level of her greater trochanter. And when she straightened her knees, we wanted it to be at about 5 to a 10-degree knee bend. And yeah, so we're gonna have her pedal for about like another minute. How you doing?
Doing good.
Okay. Let me know if it gets too difficult or you have any reason to stop.
Okay.
All right. So, I'm going to take your heart rate. I'm going to go ahead and take your pressure. All right, put your hand on my shoulder here. Close. Oh, can't do it there. All right, go ahead and relax your hand there. So her submax heart rate range is between 114 and 162 beats per minute, and so her heart rate was 130, which is perfectly within that range. And her blood pressure was about 130 over 62, so that indicates that she's also increasing with exercise, which is normal. So I'm going to want to take her heart rate again at 6 minutes, as well as her blood pressure, and then her heart rate a second time to make sure that she's in her steady state and still within her submax range. So good job. You're doing good.
Thank you.
All right, and actually, Your 6 minutes is coming up again. Oh, and before we go on to the 6 minutes, what is your level of perceived exertion? All right. And so she said she's between the light and somewhat hard, which is equivalent to a 12 on the RPE scale. So that's good. There. And now we can take your heart rate again. I'm going to take your blood pressure one more time. Just to make it. All right. Good job. I'm going to take your heart rate one more time just to make sure you're in that steady state here. Good job, you're doing great. What would you say your level of exertion is on this test? All right, so she pointed between the somewhat hard and hard, which would put her at about a 14 on the RPE scale, and her ranges were good. So I'm going to go ahead and bring this down. Cool down. Good job. So while she cools down, I was able to terminate the test because her heart rate ranges at 6 minutes was about was 140 and 143, and because they are within 5 beats per minute of each other, that tells me that she is in her steady state range, which is what we were hoping to reach in this test. And her blood pressure also increased with exercise, which is a normal response to exercise. So I'm going to have her cool down at 25 watts, keeping the RPMs at about 50 to 60 for about 3 to 5 minutes, and I'm going to monitor that and make sure that her blood pressure and her heart rate both decrease as she starts to cool down, and ensure that she has a normal response to exercise. But good job.
Thank you.
Thanks.